Hello, good morning. Assalamualaikum. My name is Dr. Noor Hamid. I'm from the Department of Community Medicine. I'm also the panel chair members for Japan USM, which is the Research Ethics Committee. For today's lecture, I'm going to go through two very introductory recapping in terms of ethics. One is to explore the historical development and principle of medical ethics. And the next one is to briefly introduce the principle of research ethics and its relevance to for doctors. So what is ethics? Ethics, by definition, is the study of nature of morals and moral decisions and how they are made. In normative ethics means that how it's normally applied, what are the norms of ethical conduct and why we should accept them. And this can transcend culture, belief system, geography, etc. But this is not always the case. Ethics in medicine, there has its varied branches. These are some of the few branches, and we shall cover only two branches, which is the medical ethics and the research ethics. Studies on ethics encompasses philosophy, sociology, and history. So why do we need ethical conduct in medicine and medical practice? Doctor-patient relationships have changed, and this changing nature from those of the paternalistic nature to shared decision-makings of the current situation. The medical profession as a specialized field with access to specific knowledge, thus the field is actually defined by this is how we define professionals. And because of that, there needs to be a standardized way of how we do things. Ethics or morality, it forms the guidance in terms of how professionals should behave and what is expected of society and from peers. Therefore, ethical codes can be broad. It encompasses ideas and aspirations of how professionals should behave and guide on best practice of interest of those who seek our help and services, etc. Now, has ethics always been central to medicine? Yes. The first oath, and all doctors are doing this, actually taking the Hippocratic Oath, which is introduced, is first to do no harm, and it protects confidentiality, it ensures integrity and benefit to the people, to the clients that we serve. Other influences that has actually influenced ethical thoughts and ethical principles, etc., can be cultural, and some of the others are codes or international codes that is presented here. I'm not going to go through them here, but we discuss a little bit later on in research ethics. So, is medical ethics flexible or is it fixed? Bouchamp and Childress actually have looked into this and the issues of differences in understandings and practice. This morality, whether what is right and what is wrong, is highly influenced by our belief systems, our culture and personal value, etc. So as a professional group of people, this makes it very difficult to have a standard practice across cultures and across nations globally. So medical practice should be standardized. It is scientifically based. Hence, we use evidence-based medicines. Therefore, the profession expects the same high standards from its members. However, as practitioners are also humans, we are also people with unique individuals. And we tend to use and fall back to our own resources. And this could be things which is virtue ethics, which is from a cultural and religious perspective and belief, to make decisions, especially those not set in standard practice. And this can be a problem simply because those values may only be of value to the practitioners and not to the patients. So, in order to overcome this, Bouchamp and Childress actually went through the literature and did a systematic review to look at what are the basic principles that holds or binds all these ethical standards together. So, they come up with four basic ones, which is what they call the principle approach, which is beneficence, non-maleficence, autonomy, and justice. Beneficence is straightforward. It talks about benefit and maximum benefit to the patients. Non-maleficence talks about do no harm to the patients. Autonomy means that the patients or the clients must have full autonomy in terms of making decisions, and when they are not able to do that, we may assist them rather than actually influence them too deeply. But usually patients will actually fall back to the medical practice for their professionals' knowledge and experience. Justice is one approach that sometimes people do not understand, and I'm going to talk about this in the next slide. Now, these are just the principal approach. It's just the guiding approach, the main guiding approach, but it's not the only one. We do use other approaches like the human rights framework, etc., to actually look into other issues as well. Now, when we talk about justice, we cannot run away from equality and equity. Equality means that we give the same treatment and the same things to everyone who requires it. Equity actually means, if you look at the picture, means that those who need it more will be given more in terms of what they need. So this stems from this concept of justice and fairness, as John Rawls' idea of justice, where social justice, according to Rawls, is about assuring the protections of equal access to liberties, rights, and opportunities, as well as taking care of the least disadvantaged members of society. Thus, whether something is just or unjust, it depends on whether it promotes or hinders equality of access to civil liberties, human rights, opportunities for health and fulfilling lives, as well as other. It allocates a fair share of benefits to least disadvantaged members of society. Now, in Islam do have this sub-concept, and because this video is targeted at Malaysians, students, postgrads, and doctors, so majority of whom are actually Muslims. So this is where I want to actually stress on that in Islam, this concept of equity is equal to the concept of adil in Islam, which is to place something in its rightful place. In clinical practice, we talk about equity as being giving or treatment to patients which is at its rightful place and patients' right, etc. But in justice, in public health, is even more obvious, where we emphasize on the equal access to society resources. So these are some of the guiding ethical sites that you can go into, because I was trained in Ireland, so I find the Irish website from the Irish Medical Council is very helpful, but the UK GMC is very comprehensive as well in its guidance, and we do have the Malaysians one, which is the MMC, and its ethical guidance. Now, next I'm going to move on to research ethics. The purpose of research is to discover new knowledge, and such knowledge that we use, that we have produced, etc., okay, we translate them into evidence for policy or for our practice. Thus, human research, when we do research, is the shared process between the researchers and the participants. So for research ethics, there are some basic principles, which is respect, benefit, and justice. Respect means that we should respect our research participants as another human being and their belief systems, etc. For example, when we're dealing with Muslim population, especially in Malaysia, etc., one example that I can give is actually when we do research with Muslims and anything that require consumptions like food products and etc., we need to consider the halal status of the product, simply because that is one aspect of the culture and belief systems of the Muslims. Is the everything needs to be, the food consumed needs to be halal. So that is showing respect to the culture of the participants. Benefit means that we need to have maximum benefit. That research, it doesn't just benefit the researchers in terms of publications or in terms of knowledge knowledge produced, etc., but those whatever comes up from research might also benefit the participants of the research. Justice is the same as what I have mentioned just now in terms of looking after the most vulnerable of populations, and this concept will be translated into another concept, what we call vulnerabilities, later on that we're going to talk about. So let's go into some of the research ethics and the historical developments. And we do learn from a human tragedy. The Nazi war crimes is where a lot of the scientific research on chemicals, on biological warfare, etc., was actually tested on the Nazi Jews, on the Jews during that time, and they were not told about it, and they were actually subject to a lot of horrendous type of treatments, etc., just for scientific knowledge. Another one that is quite famous is actually the Tuskegee syphilis experiment. This is where syphilis, when it first came out, we don't know anything much about syphilis itself. So a group of researchers actually look at the black Americans in the southern part of America and to observe them in terms of the disease progress, etc. And what is more horrendous is when there was actual treatment with antibiotics, which can show that we can actually treat syphilis successfully, this patient was not given those treatments and were left with simply observing in the name of science to see what's the degrees progressions. So these are some of the international codes. In the left column, you can see some of the international codes or reports that have been produced worldwide. In the right column are the things that they actually emphasize. The Nuremberg trials or the Nuremberg report actually focus on the Nazi war crimes. And this focus on consent, qualified research team, appropriate research design, the risk-benefit ratios, and ability to withdraw. Declaration of Helsinki actually talks a lot about the well-being of the participants. whereas the Belmont report sets the foundation for ethics in research for respect, benefit, and justice. And there are other forms of codes which is available. The CIOMS, which is the Council for International Organizations of Medical Sciences, has 25 basic guidelines, and this forms one of the basic foundations for those in the medical and health sciences. So I'm going to talk a little bit about JPAM, or our Human Ethics Research Committee, but bear in mind that all research committees behave differently and they do things differently, but essentially they do actually the same thing when it comes to research protocol assessments, which is to assess the protocol for risk and benefit of the research. So there are two components that we do. One is actually the scientific assessments, and the other one is the ethics assessments. The scientific assessment talks about the value of the research, the benefit of the research, and it's about good science, the methodology, etc. And embedded in all this methodology, etc., is where the ethical conduct or ethical assessments takes place. Okay, so we emphasize on how the participants are being treated and the risks that they have to undergo during the research process. In ethics assessments, especially for USM, we emphasize on protections of the participants. So there are three protections of people. So there are three groups of the three groups that we're interested in when it comes to protections. One is the research participants, one is the researchers themselves, and the third one is institutional names and good names, etc. Okay. Now, we go by the concept that we are not implying that researchers or bad researchers who do unethical things, but we want to make sure that, and we want researchers to be aware that things may go wrong, and there are adequate plans to overcome what may go wrong, or ethical issues or potential problems, etc. Because we know that, as researchers, desperate people will do desperate acts, and sometimes those actions can be beyond what is ethical or acceptable within the field. So from my experience and the common issues that we experience in JPAM USM is there's lack of justification of the studies, or the study has been repeated, the methodological issue giving rise to serious ethical issues or concerns, etc. Then there are other ethical issues which is much more sort of like principles which is quite specific to research ethics that we emphasize on, which is one is vulnerability. Vulnerability means that there are the two forms of vulnerability when it comes to research participants, how they are vulnerable in the research. One is what we call the categorical vulnerability, which is standard group of participants, which is vulnerable. This could be pregnant women, fetuses, children, elderly, and some other groups as well. Okay? Alright. So the literature suggests that this group of people are vulnerable simply because they are not able to give consent or consent freely for the research. But another form of vulnerability that I want to emphasize on is what we call contextuals or contextual vulnerability. This is where it's the context of the research itself that place the participant in a very vulnerable position. For example, when you're the treating doctor and you want your patients to be part of your research participants, whereas the patients are there to actually seek treatment from you as a health professional. Okay, so your role now is actually two roles. One is the doctor and one is the researchers. Well, the patient roles now is actually as a patient and a participant. Now, the patients are there to seek treatment. The doctor is the one with the power to control the treatments and to give the treatments, etc. Now, we're saying that, not doctors are bad people who withhold treatment, etc. But the participants or the researchers or the patients needs to be assured that they can participate in research willingly and freely, and that is not going to remove their rights as patients. Okay? So, in these situations, the patients, given the context, they may not be vulnerable populations, but they are vulnerable in a sense that they are dependent on the doctor, who is also the researchers, on their treatments, and may not be willing to say no to the treating doctor in terms of participating in their research. So there is issues there in terms of vulnerability that needs to be declared and dealt with in terms of how this should be dealt with. So in terms of these type of situations, when it comes to doctors as researchers, the doctors need to make it very clear to the participants that their refusal to participate is not going to affect their treatment plans or treatment standards, etc. when we talk about a conflict of interest, the international guideline emphasize on conflict of interest of the sponsors body and those related to the IRB or the ethics board in terms of approval. Is there any a conflict when it comes to the research? Now, this needs to be very carefully interpreted. One is that when it comes to conflict interest with the funding body, does the funding body has anything to or any influence in terms of the studies? We know from the literature and from past experience that some funding body will suppress results which is negative results or which they don't like, etc. Thus making it that the results which is negative, which may be of benefit to humanity, is not released to the public. Okay. Now, another interpretation or more of a softer interpretation is what I've just talked to you just now in terms of conflict interest. The doctor's role as a researcher versus the patients and the patients and the participants basically. Okay, so that needs to be declared in terms of the conflict interest. All right, compensations. Compensation needs to be fair. In other words, when participants help us with studies, they should be compensated. If they're asked to attend the studies and they have to fork out their own money or they have to actually pay for the traveling costs, etc., then that is not fair and that is not right. So the study team needs to find some way to actually compensate for that or reimburse their traveling costs. Okay, but a lot of research, especially local research or what we call self-sponsored, or the researchers are doing as a part of a master programs with no funding, etc., then we do acknowledge that, and in such circumstances, it needs to be made clear to the research participants that they are not getting any compensations, and compensations can be formed in other forms, basically, whether it's in the form of knowledge, educating the participants, etc. Okay? Confidentiality and privacy, we talked about the protections of the privacy and the data security of the participants. This is where we need to make sure that all the data are anonymized and that we cannot trace individuals within the data, etc., and no individual data should be reported. So, how are this related to me? In the modern world, doctors cannot run away from doing research, and we also cannot run away from practicing. Okay, so when we realize the importance of ethics and how this is related to our practice, okay, so as a specialist or future consultants, we have to set standards in making sure that such standards are protected and practiced in the name of the professions. The Hippocratic Oath actually put it very clear, and this is a translation, that I will keep pure and holy both of my life and my art. So it's not just about practice, but it's about us as doctors, as somebody who is actually, as somebody who's in the eye of the society, of have different status and different trust level, etc. We need to make sure that ethics and integrity is being practiced in our lifestyle as well. Okay, so we have to embody this ethics and morality of this codes, making them part of our daily living rather than actually just practice. Okay, with that, I thank you.